With a deep breathing exercise to ground us. So, this will take about 1 to 2 minutes. It's a deep breathing and it's made specifically for blood pressure reduction. So, before we get started, I'd like to take just a minute to help us arrive, settle in, and give our bodies a chance to relax. One of the simplest and most effective ways to support healthy blood pressure is controlled breathing. So we're going to practice that together. Go ahead and sit comfortably, both feet on the floor. You can let your hands rest in your lap. And if it feels comfortable, gently close your eyes or soften your gaze. Let's begin by taking a slow, deep breath in through your nose. 4, 3, 2, 1. Hold your breath gently at the top. 1, 2, and exhale slowly through your mouth. 6, 5, 4, 3, 2, 1. We're going to repeat that again. So you're inhaling for 4, you're going to hold for 2, and then you're slowly going to exhale for 6. So inhale, 2, 3, 4, hold, and exhale. 6, 5, 4, 3, 2, 1. Now I want you to continue at your own pace, feeling your breath move in, holding, and out. Allow your jaw to relax. Allow your shoulders to soften. And notice the rhythm of your breathing become a little smoother and a little deeper. Let's take one last cleansing breath in together. Inhale big. Hold. Slowly exhale. When you're ready, you can gently open your eyes. This simple breathing pattern can help calm the nervous system and lower blood pressure in just a few minutes, which is something we are going to explore more. So hello, officially. My name is Katie Powell. I am a well-being consultant here at Care First, and I'm so excited that you're here with us for today's presentation. If you were here in January, we kicked off our 2026 Wellness Wednesday webinar series by focusing on prioritizing winter wellness. I'm sure many of you got a really heavy dose of winter these last couple of weeks. Our key takeaways included finding innovative strategies to be active in the winter, focusing on how you can improve your winter nutrition, your winter immunity, as well as your overall winter mental well-being. Now that it's February, it is National Heart Month, and we are going to expand on prioritizing our well-being by focusing specifically on hypertension. We're going to learn symptoms, risk factors, and ways to build and manage resilience. And we have a real treat for you today. We have Dr. Ajoy, our guest speaker, with us. Dr. Joy is an internist with over 15 years of experience in the medical field. He has a range of experiences serving in different roles, including primary care physician, associate medical director of hospitalist program, chief medical informatics officer, and core facility of an internal medicine residence program. He's also worked for several years as a principal investigator at the NIH, looking into mechanics links between hypertension, heart disease, and aging. He is currently our medical director of on-site inpatient management team that is monitoring the care received by Care First members at various health systems throughout Baltimore. So I am going to pass it over and warmly welcome Dr. Ajoy.
Hello, can you hear me?
Yep, you sound great.
Okay, thank you. Thank you, Katie, for that introduction, and thank you for the breathing exercise. That was so relaxing. Thank you so much. So like Katie said, we are going to be looking at heart health and more specifically about hypertension today. And like Katie said, February is the National Heart Month. And so let's learn more about heart disease and hypertension. So as far as understanding heart health, we first have to know what is heart disease. So heart disease, two common terms that you'll hear are cardiovascular disease and coronary artery disease. And these are terms that are related. Now, cardiovascular disease is a broader term. It includes a group of disorders, any disorder that affects the heart or the blood vessels, right? And so these include diseases like stroke, coronary artery disease, congestive heart failure, arrhythmia, maybe even peripheral vascular disease, which is disease of the circulation in the legs. And 1 in 3 deaths in the US is caused by cardiovascular disease. Now, very close related to this and included in cardiovascular diseases is coronary artery disease. And this specifically is disease of the blood vessels of the heart itself, and that manifests as chest pain or heart failure or heart attacks. Now, sorry, 1 second. Now, some key heart disease facts. Each year, someone in the US is dying from cardiovascular disease every 34 seconds. 20% of Americans don't know they have a heart health issue. 33% or 1 in 3 of deaths in America are caused by heart disease. And 20% or 1 in 5 Americans suffer from silent heart attacks. You have a heart attack and you never know about it, right? Okay, you can go to the next slide. And so closely related to heart disease is the syndrome of the metabolic syndrome. What metabolic syndrome is that it's a constellation of 5 different components. And those components are visceral obesity, which is obesity around your midriff, right? Hypertension, insulin resistance, high triglycerides, and low HDL cholesterol. And so if you have more than 3 out of 5 of these components, you have a higher risk of heart disease. And 1 in 3 adults in the United States has metabolic syndrome. And the way that these components work is that if you have an individual component, you have a higher risk of heart disease. But then the more components you have, they don't just add up. The effect is multiplicative. They act synergistically to increase your heart disease risk several-fold, right? And so hypertension is an important component of the metabolic syndrome. It interacts with the other components in the metabolic syndrome to drive up the risk of heart disease. We can go to the next slide. And so then we come to the question of what is hypertension. We can go to the next slide. So question before we start off. Approximately what percentage of adults in the US are living with high blood pressure? I see the response is still coming in. Okay, so 65% of adults is the answer. Yep. So the answer actually is, it's a little bit lower. 1 second. Let me click out of the spot. Okay, so the answer is about 50% of adults in the US is living with high blood pressure. But, you know, it's slightly lower than the poll estimate of 65%, but 50%, 1 in 2 adults in the United States is living with high blood pressure. That's a huge number, right? So how do we define high blood pressure. So when we're talking about blood pressure, there are two numbers. There's a top number. Usually we say 120/80. So the top number and a bottom number. The top number is the systolic blood pressure. The bottom number is the diastolic blood pressure. And the top number is, both of these numbers basically are measuring the tension in the wall of the artery when you compress it, right? So systolic blood pressure is when the heart pumps blood out of the heart and into the artery. So it's pushing the blood into the arteries, and this causes the artery to expand, and this increases the tension in the arterial wall. And that tension or pressure in the arterial wall is what is the systolic blood pressure. Now, when the heart stops pumping and it relaxes, then the arteries can also relax, but it doesn't go to zero. The pressure in the arterial wall doesn't go to zero. It goes down to what is the diastolic blood pressure. So we can go to the next slide and see what those pressures should look like. So blood pressure categories. So what is normal? Normal blood pressure is, so you see, so are you able to see my pointer or no? No.
Don't think so. No.
Okay, that's fine. On the left, you can see the systolic blood pressure, and on the right, you can see the diastolic blood pressure. And so for normal, the systolic blood pressure should be less than 120, and the diastolic blood pressure should be less than 80, right? And then the next category down is elevated, for which the systolic blood pressure should be 120 to 129, and the diastolic should be less than 80. So you will notice right away that if the diastolic blood pressure is more than 80, right, you have hypertension, right? There isn't a sort of borderline category there. If it's more than 80, you have hypertension. And then basically you go through the different categories of hypertension there. You have stage 1, stage 2, severe hypertension, and then you have hypertensive emergency with progressively increasing blood pressures. What's different about hypertensive emergency is that not only do you have a high blood pressure, but you're starting to have effects of the high blood pressure on organ systems. So you're having symptoms secondary to the effects of the high blood pressure on your major organ systems. And the same thing is shown on the chart on the right in a more graphical representation. You can go to the next slide. So what are some of the health threats from hypertension? So see, these are some of the big ones, right? Because of high blood pressure. You have stroke, you have heart failure, you have sexual dysfunction, vision loss, heart attack, and kidney disease or failure. And so these are some of the big ones, like I said, but there are so many effects all across the body that hypertension can cause or lead to. You can go to the next slide. And so how does hypertension cause disease? I know this slide has a little bit a lot going on. So we'll start with the one on the left, where you have the small picture of the circulatory system. And what you can see is that you have the heart right in the middle. You have two sides to the heart, and actually it's a mirror image. So the blue is actually the right side of the heart, and the red is the left side of the heart. And the function of the right side of the heart, the blue part, is it brings blood in from the rest of the body, and then it pumps into the lungs, right? And the lungs then oxygenate the blood, put oxygen into the blood, takes it to the left side of the heart, which is the red side. And then the heart has to pump that blood all over the body. It has to pump the blood to the brain, to the liver, to the kidneys, and to your legs, right? So all over the body. That is a huge ask of the heart. And what it has to do, so at the end of, when the heart is relaxing, the pressure in the heart is about 20 millimeters of mercury. But we saw earlier that your blood pressure is 120. So it really has to build up the pressure all the way up to 120. Now, if you have high blood pressure, say you have a blood pressure of 160 or 180 systolic, right? Now the heart has to work that much harder to increase the pressure to 180. So that causes the heart muscle to bulk up. And normally, bulking up on muscle is a good thing, but in the heart or in the blood vessels, it's not a good thing, it's a bad thing. And so in the heart, when that happens, one, it tries to keep up, and sometimes it cannot keep up, and all of this leads to heart failure, right? And heart failure itself causes decreased blood flow to the different organs in the body. So that's mechanism one. The second mechanism is that you can see that high blood pressure, like we started off talking about, is the pressure of blood against the arterial walls. And so the higher blood pressure, the higher the pressure in the walls of your artery. and that's going to cause damage to the arterial walls over the long term. It's also going to lead to damage downstream from the arteries, right? So if you go to the picture in the middle, you can see that you have the red artery, and then you have like a net-like structure in the middle, and then you have the blue veins. And most of the oxygen transfer, or for example, your brain, right? The way that your brain gets oxygen and nutrients and glucose and everything that it needs is from the capillaries. That is the net-like structure in the middle, right? Normally, this is a very low pressure system. But when you have high blood pressure, what's going to happen is that you're going to have the high blood pressure in the arteries transmitted to these capillaries, and they burst. They're not able to handle the pressure nearly as well as the arteries because their walls are much thinner. They're like less than a millimeter, right? And so when the capillaries burst, that's when you get bleeding into your brain or other organs, right? So that's mechanism 2, is the damage to the arteries as well as the capillaries. And then mechanism 3 is that when you have this damage to the arterial walls, it's going to drive deposition of cholesterol, and then you're going to have plaque buildup, and then your arteries are going to become narrower, and that's going to further affect the circulation to the organs, right? So we talked about heart failure. We talked about the wall stresses on the arteries and the damage that it can cause and the rupture of the capillaries. And we also talked about plaque buildup and the narrowing of the arteries. So these are some of the mechanisms that how high blood pressure can cause disease. We can move to the next slide. And so what are some of the risk factors and symptoms from hypertension? So hypertension is called a silent killer because it usually has no symptoms, right? Like we said at the beginning, 1 in 5 adults, have a silent heart attack. They don't know about it. Again, hypertension is a silent killer because usually it has no symptoms. Some of the symptoms it can cause, when it does cause symptoms, are headache, shortness of breath, nosebleeds, dizziness, fatigue, blurry vision, etc. Next slide, please. And so what are the risk factors for hypertension? So hypertension can be influenced by many things, including modifiable risk factors as well as non-modifiable risk factors. So some of the things that you cannot control are age, race, ethnicity, family history, pregnancy, hormones, etc. But some of the things that you can control are weight and diet, activity, diabetes, your blood sugar levels, your cholesterol levels, vaping, alcohol, your oral health, sleep apnea, stress, and depression. And so we're going to go in a little bit more detail about some of these major risk factors for hypertension. So, question. I've read that red wine may offer cardiovascular benefits. Therefore, consuming it in unlimited quantities is acceptable. What does everyone think? Myth or fact? Hi, Melinda. I like your response. Put in the chat, myth. I think myth is leading right now. Okay. So yes, I think it was kind of a leading question, right? If in this kind of a forum, if we ask that kind of a question, right? So yes, it is a myth that you can consume any alcohol in any quantity and that it would be beneficial. So we can go to the next slide. So yes, heavy and regular use of alcohol can greatly increase blood pressure, and so the recommended drinks per day for men is less than 2, and for women is less than 1. So generally, one drink. What does one drink mean? It means 1 beer, or 1 glass of wine, or 1 shot of whiskey, vodka, or rum. So I saw a comment about sharing the slides. I think we will be sharing the slides. Okay. So we can go to the next slide. So what are some of the ways to prevent and manage hypertension? So it starts with monitoring your blood pressure at home, right? And so some of the things to note when monitoring your blood pressure at home are, before measuring, make sure that in a well rested state, right? You've emptied your bladder, no caffeine, you've taken some rest, you've removed tight clothing, and then make sure you have your feet in the ground, your arm is resting against the table. Ideally, the blood pressure cuff on your upper arm should be at the same level as your heart, right? Because we're just using hydraulic principles here to try and get the blood pressure in the heart. So being at the same level helps us get a more accurate reading. And then avoid, crossed legs, unsupported arms, or talking while you are checking your blood pressure. Now, as far as the correct technique is concerned, you need to make sure that the cuff is above the elbow joint. And excuse me, sorry. If there is one takeaway from measuring blood pressure at home, it's to make sure that the blood pressure cuff does not overlap your elbow joint. I've seen this mistake happen so many times, right? So if any part of the lower end of the blood pressure cuff has to be at least 1 inch above the elbow joint. If the blood pressure cuff is compressing onto the bones in your elbow joint, you're going to get a wrong reading, because the blood pressure cuff is going to think, oh, this pressure is so high that I cannot compress it, when really what's happening is that it's compressing it against the bones, right? So it's very, very important that no part of the cuff is over the bones in the elbow joint, okay? So that's a very important point. We can go to the next slide. And so when you're measuring your blood pressure, the other thing to note is that you can take a couple of readings, maybe about a minute apart, and also make sure that you write it down in a logbook, in a journal, if you have one. It would be best if you can actually write it down. And then when you take it to your doctor, you need to take the journal with you so that they can have a visual representation of how your blood pressure has been running. And more than one abnormal reading, I think it's the trend that is more important, right? How has it been running over time? How has it been running from day to day and week over week, etc.? Now, in terms of automated blood pressure cuffs, right, you have the ones that go on your arm. I saw the question in the chat, and you have the ones that go in the wrist. And generally, what has been thought of as being more accurate is the one on the arm, because you are compressing a major artery. You can, if you put your fingers on the medial aspect, on the inner aspect of your arm, you can actually feel the artery pumping, right? And so that's a much bigger artery. And like I said, if you're using hydraulic principles, it's almost at the level of your heart, right? So it's generally considered to be a more accurate reading of your blood pressure than the one on your wrist. However, newer wrist machines, as well as your smart devices, are now all wrist-based. And again, they're getting better at getting an estimate of that blood pressure. And again, like I said, it's not about the one blood pressure reading, but it's also about the trend. So if your wrist blood pressure is, say, 130/80, and it's consistently at that level, that's one thing, versus, you see slowly creeping up to 140, 150, then you have the problem, right? Okay, so how to lower your blood pressure? These are some of the techniques, some of the things to keep in mind: lose weight, regular exercise, eat healthy, increase potassium-rich foods, limit salt intake, avoid smoking, limit alcohol use, take medications as prescribed, and monitor your blood pressure regularly. Now, these are good not just for hypertension. I think the one that is specific to hypertension is limiting salt intake and increasing potassium-rich foods, but these are good kind of directions for most, for general health, right? Regular exercise and eating healthy. Now, as far as increasing potassium-rich foods and limiting salt intake, obviously, these are general recommendations. You have to always consult with your doctor before you adopt any of these measures. The reason I'm saying that is, for example, some people with hypertension also have kidney disease, because the hypertension has affected the kidney disease, or maybe they have kidney disease to start with. And those people cannot tolerate potassium-rich foods, right? People with kidney disease cannot really handle potassium. So before you adopt any of these measures, always have that discussion with your provider. These are general guidelines. Okay. As far as limiting salt intake, the recommendation is less than 2,300 milligrams per day. But ideally, if you can do it, get it down to 1,500 milligrams of sodium a day. And we will see we can go to the next slide and we can see that is quite difficult. It's not easy, and how to get there, right? So as far as your diet is concerned, your diet has a big influence on your blood pressure, sodium intake, limiting processed foods, focus on whole foods, increased intake of soluble fibers. And you can see the recommendation here regarding the DASH diet. So the DASH is an acronym for dietary approaches to stop hypertension. And what it's focusing on is fresh fruits and vegetables, and lean protein, legumes and nuts, fats, and but limiting fats and sweets, and having whole grains. Now, the DASH diet is very much focused on reducing the sodium intake, and it's very much focused on hypertension, and it works really well, right? In terms of decreasing the blood pressure, decreasing the sodium intake, etc. A diet that is very similar to the DASH diet is the Mediterranean diet, which is a little bit more general than the DASH diet, and it's more for overall heart health, overall health. The differences being that it's not so focused on the sodium intake piece, and it's not so much focused on having it uses more of olive oil for the fats, whereas the DASH diet focuses more on, say, canola oil or other very polyunsaturated fats. So slight differences between the two, with the DASH diet being the recommended diet for hypertension. Okay, we can go to the next slide. So let's do a quick knowledge check. Let's say you go to Chick-fil-A for lunch and order a Chick-fil-A fried sandwich. What % of sodium daily intake are you consuming? Okay, so I think the winner is greater than 60%, and to the 107 people that answered that, yes, that is the correct answer. So 60%, greater than 60% of your sodium intake you can get from one Chick-fil-A sandwich, and that's without fries or sauces. So if you add fries and sauces to the mix, you can easily go over the total recommendation of your daily sodium intake, right? You can get more, you can go over 100%, right? The other thing that I see oftentimes is patients come to me and they tell me, oh, I'm eating healthy, I'm eating vegetables, but my pressure is not under control. Why do you think that is? And a lot of the time, the mistake that happens is that the vegetables are coming out of a can. So anything that comes in a can has an extremely high sodium content, right? So even if it's vegetables that's coming out of a can, even if you throw away the water that the vegetables were in the can, it is still having a high sodium intake. So just be aware of that. And the other pitfall is that people don't associate a high sodium intake with a lot of sweet foods. But if you look at cereal, if you look at the cereal box and you look at the sodium content of it, it's about 300 milligrams of sodium. That's a lot, right? So even sweet food can have sodium content. Almost every food has sodium content. So you need to be very cognizant of that fact. And when you start adding up the numbers, 1500, which is the ideal, is, or even 2300, which is the recommended, are very easy to go over, right? So generally the recommendation, not just for hypertension, but also for general health and heart health, is when you go into the grocery store, do not shop in the aisles. Do not shop in the aisles, but shop around the aisles, because that's where your fresh fruit and your fresh vegetables and your produce and your healthy stuff is, right? Fish, meat, fresh meat, fish, etc. So that's the general recommendation. Now, in terms of managing weight to control elevated blood pressure, you need to be cognizant of it. Think about, so it's basically calories in minus calories out, right? And so you need to think about your eating habits, be more active, decide ahead of time how to handle temptation, breaking habits, plan ahead and be realistic and expect setbacks. In terms of breaking habits, there's a book called Atomic Habits, which is really, really helpful in kind of working with your natural instincts to try and break some of those very difficult to break habits. Okay, we can go to the next slide. Another big thing that I would like to focus on is stress and hypertension, right? So stress both in the short term as well as in the long term, can lead to hypertension, high blood pressure, right? So in the short term, yes, your blood pressure can go up very high. But then there are some mechanisms that if you're chronically exposed to stress, will become more hardwired into your system. So stress causes the release of certain hormones, and those hormones then can drive your high blood pressure. Again, if you have chronic anxiety or you have depression, there are other mechanisms that come into play to, again, drive up your blood pressure. And so thinking about the holistic picture, managing your stress, managing anxiety, managing depression, talking to your provider about that to see what is the best mechanism to deal with these kind of very vicious cycles is important to do. We can go to the next slide. And then lastly, this is the last slide for me. So it's about special types of hypertension. And so there are so many different types. These are some of the 4 that I thought I would just highlight here. So resistant hypertension is high blood pressure that persists greater than 6 months despite treatment. Again, talk to your doctor. Some medications may need to be adjusted. You may have to dive deeper and in more detail about your diet and your daily habits. White coat hypertension is high blood pressure at the doctor's office. So when you check it at the doctor's office, it's high. When you go home, it's normal. Some of that might be due to the anxiety and the stress of the situation. But there are some studies that suggest that it might be a predictor for long-term hypertension in the future. Ambulatory hypertension is high blood pressure during walking or activity, but when you're at rest, the blood pressure is normal. Again, some studies suggesting that this is a predictor for hypertension long-term. And then finally, you have secondary hypertension, which is high blood pressure due to some other disease. So on this last one, right, typically when we talk about hypertension, we're talking about what we medically call essential hypertension, because there's no real disease, underlying disease that is driving the high blood pressure. You just have it. It's either genetics or part of the aging process or part of some of the other risk factors that we talked about. Secondary hypertension is different. You have some other disease, either hormonal or non-hormonal, that is actually driving the blood pressure. And then when you identify and treat that underlying disease, then your blood pressure also gets treated. This is very rare, though. This is very, very rare. It's not. 99% of the blood pressure, the high blood pressure that we see is primary or essential hypertension. Okay, and I think that's the last of my slides. And I think I can take some questions now and then turn it over to Katie.
Awesome. Yeah, we have some questions for you. Let me actually start with this one. Is there any reason not to take your blood pressure at home while lying down?
So we want to keep it consistent, right? So when you're lying down, think about what's happening to the heart, to the blood flow, right? So one, the blood is when you're lying down, your heart blood is pumping blood. The task for the heart to pump blood into your circulation is a little bit easier, and therefore the pressures that are going to get reflected in the arterial wall is a little bit higher, right? Additionally, you have blood coming back from your legs, right? For blood to get back from your legs to your heart, it is working hard against gravity when you're sitting or standing. So the amount of blood getting back to your heart, we call it the venous return, is lower when you're sitting or standing. So the amount of blood in turn being pumped out by the heart is lower, and therefore your blood pressure is lower. So when you're lying down, summary is that your blood pressure might actually be a little bit higher, maybe, right? But in terms of maintaining the consistency, right, you're going to check your blood pressure, you're going to write it down in your journal, you're going to take it to your doctor, and in the doctor's office, your blood pressure is generally checked when you're sitting up, right? Or at least that's the recommendation. So keep it consistent across measurements, across settings. The recommendation is to do it, sitting up, feet on the ground, hand on the table, and the arm at approximately your heart level.
Great, thank you. Can a diagnosis of high blood pressure be reversed permanently, or does the diagnosis stay with you for life?
That's a very good question. So yes. So like I said, in some cases, the driver of high blood pressure is some other disease. And if you correct that disease, then your high blood pressure might go away. But in most cases, what we call high blood pressure, hypertension, 99%, or at least more than 95% is what we call essential hypertension. which is high blood pressure that has built up over time because of aging. Your arteries get stiffer over time, just based on your age, right? And also, genetics plays a role, and some of the other risk factors that we talked about in terms of how, high of weight and diet also plays a role. Now, weight loss does help with improving blood pressure, right? So some people who lose weight or a significant amount of weight have seen their blood pressure problems go away. Same thing with your diabetes problems. They tend to go away if you lose a significant amount of weight. So that's one thing, right? But the basic processes that are driving the thickening of the arteries are a chronic process, and those things increase over time, and they're generally not reversible, there are certain studies, and that's some of the research that I was doing at the NIH and the NIA, is that are there certain things that can reverse that aging of the arteries, that stiffening of the arteries? And there are theories about some molecules in red wine that might be able to do that, but it's not confirmed, right? So at this point, essential hypertension, in most cases, is not a reversible process, but it's something that you can very much control and you can manage really well. Now, the other misconception is that if my doctor puts me on a medication, that means that I'm going to be dependent on the medication for the rest of my life. Or the inference there is that the medication is going to cause you to have high blood pressure. And that is not the case, right? The medication itself is not going to drive hypertension. The medication is only there to control your blood pressure and prevent you from having a stroke. And if you can lose a significant amount of weight and change your diet significantly and get your blood pressure under control, there's definitely the medication can come off. So hope I answered that question.
Yeah. Any advice if a medical staff is attempting to test the blood pressure over clothing? Should we say something?
See something, say something, right?
Yeah.
Yeah, I mean, if it is loose-fitting clothing, the impact on the hypertension may not be so much, right? But if it's over multiple layers or if it's tight-fitting clothing, then the impact on the blood pressure is going to be probably significant. And so in those instances, yes, you could ask the question of whether, you would be able to get a lower blood pressure reading if you were to, remove your clothing.
Okay. When should someone consider going to a cardiologist as opposed to an internist?
Wow. So I think that's a conversation to have with your internist, right? Most of the blood pressure is managed by an internist, right? And for very good reason is that the medications that we have in the market have been tested in clinical trials, have been rigorously used for decades. We know what they do. We know approximately how much of a reduction of blood pressure you're going to get from each of those medications, what the side effects are, et cetera, et cetera. So they're very well known, right? So in the vast majority of cases, I think that an internist is very well positioned to handle your blood pressure, and additionally, really dive into your lifestyle, your dietary intake, your exercise regimens, etc., and be able to advise you regarding that. Certain cases of hypertension, like I said, are more complex. For example, maybe the secondary hypertension or the resistant hypertension, and at that point, maybe a cardiologist would come in helpful. Also, if you're having side effects of the high blood pressure, like it's starting to affect your heart and you're having heart failure or symptoms of that, then that might be a time to see a cardiologist.
Great. And our last question, frozen vegetables seem to be a hot topic. What about frozen veggies? Are they okay to eat? Do they have a lot of sodium content? What are your thoughts?
So frozen vegetables are generally okay, right? They are much better than the ones that comes in the can, right? And the issue is with the process of the can itself, of the canning itself, because they add sodium to help act as a preservative, which that problem does not exist in the frozen vegetables because there the preservative mechanism is freezing, right? So that's the difference. So anything that comes in a can, whether it be vegetables or anything else, they contain tons of sodium by definition.
Wonderful. Well, thank you. I know we have some more questions, but we're gonna switch to our wrap up. Dr. Joy, thank you so much for taking the time today to give us such a thorough and amazing presentation. I know I learned things. Definitely going to second guess my Chick-fil-A order from now on and be more aware. So we really appreciate your time and all of your information.
Thank you. Thank you so much. It was my pleasure.
Yeah. All right. Well, as we move into the new year, our first three webinars, winter health, heart health, and nutrition, they all work together to set a strong foundation for whole body well-being. We began by focusing on staying healthy through the winter months, and then we today explored practical habits to support a healthy heart. Our upcoming nutrition webinar will continue building on these themes by highlighting how a balanced diet, um, balanced food choices can also build immunity, fuel energy, and long-term health. Together, all of these sessions help kick off the year with simple, sustainable steps to feel your healthiest. As we wrap up, we always want to give a quick overview of the Care First resources that are available if you have Care First coverage. This is something you may want to check with your benefits on or your HR team, but overall, Care First Wellbeing is your go-to solution for everything health and wellness. It is your one-stop shop. Within Care First Wellbeing, you have access to the Real Age Health Assessment, personalized timeline feed. We have tracking capabilities, ongoing challenges to keep you engaged. You have your own health profile where you can access all your important health data in one safe and secure place, as well as core programs. Now, today we talked a lot about how to lose weight. How to lose weight, how to um, lower your blood pressure. And at Care First, we have plenty of programs that can assist you. We have one-on-one health coaching. There's two different pathways. We have lifestyle management, which can help with your diet, your stress, your sleep, tobacco use, and more. And then we also have disease management, which if you have one of the 10 core chronic conditions, you could qualify for. Both of these pathways are completely telephonic, and you get a dedicated health coach to specific to you and your healthcare journey. The only difference is in lifestyle management, you'll work with a certified health coach, and in disease management, you'll work with a registered nurse or some type of clinician. We also offer two weight management slash diabetes prevention programs, and this is because we know everyone learns and receives information differently. You do need to qualify for these programs. They are called Noom and Eat Right Now. These programs help you to reach a healthier weight and reduce your risk of developing diabetes. To know if you qualify, you can go into Care First Wellbeing, navigate to the program section, and click on the appropriate tile. It will ask you a couple of questions and let you know if you qualify. Essentially, having an elevated BMI of 25 or greater or a prediabetes diagnosis will qualify you. And again, Noom and Eat Right Now are structured differently, so you can learn more about them within Care First Wellbeing. We also have a smoking cessation program called Craving to Quit. This is a 21-day program that provides you the support, the tools, and the resources to help you quit successfully. Financial well-being is our financial piece of Care First Well-being. We know that stress correlates with high blood pressure. So if finances are of interest to you or causing you stress, you can absolutely access our Smart Dollar program, which provides videos, tools, all kinds of documents, calculators, etc., to help you reach your financial goals. And then Blue 365 is our exclusive discount program. The Care First Blues Association has negotiated discounts with retailers across the nation on a wide category of discounts. Some of them are health and fitness, but some have to do with things like travel, family, pets, and more. All right, and as always, Care First, we like to wrap our arms around our members and provide as much resources and support as possible. Feel free to check out the latest guidelines for preventative screenings and services, as well as visiting our library for a wide range of topics and wellness tools. And then for anyone who's facing serious or complex healthcare needs, you can access our care management program. For anyone who did ask, this presentation will be sent out. It's usually about 1 week afterwards. We package it all up with the recording of the presentation, the slides, and some wrap-up information. And that will be in your email box roughly about a week. But we want to thank you so much for attending today's presentation and for our guest speaker, Dr. Joy. We will be back next month, hopefully feeling a little bit better, and we will talk all things nutrition. Have a happy and healthy day.